All right, so this is our last talk, so we're wrapping up the session and then also all of boot camp. Since we're getting close to the Q&A, if anybody has questions online, we have about 80 people who are dialed in right now, or in the room, you can put it in the app, or if you're here in the room, we'll also have time at the end if people want to come up to the microphone too. So both are fine. So with that, our last talk, the omega of resident boot camp, beyond competencies and milestones, becoming great, John Lichtenberger.
Hello, everyone. Thank you so much for having me. This is the most stressful talk I will have ever given. I just followed a talk saying I shouldn't say and I mean, that was amazing. I feel a lot of pressure right now, but I'm going to do my best. So thank you, first of all, for inviting me and having me here to speak on this topic. My anticipation was it was going to be mostly residents, but I see my mentors in the room, people who have really contributed to my career, and thank you so much. And I will talk mostly about residents, and I'll really focus on that, but maybe we can all get something from a talk today. Oh, sorry. So when I heard that we were doing a boot camp, I got a little nervous. The last boot camp I was in, there was a lot more screaming and yelling, a lot more push-ups and crying, and I promised not to scream and yell. I also promised not to cry during our lecture today. We're going to talk about this conversion and this step forward beyond milestones and competencies. And what does that mean? That means that the ACGME has set out kind of brilliantly a whole pathway for us to become radiologists during residency. But I think lately we've been discovering, or we think that maybe that's not quite enough to just hit milestones and set these expectations, but without a larger thought about what is our ultimate goal. Our ultimate goal is probably not just to be competent or to pass milestones. Our ultimate goal is probably to be the best radiologist we can be and to be truly great. Now, I will say that this is going to be an unconventional lecture with a lot of thinking and some word slides and not a single chest radiograph, but I am not a life coach, and I am also not a TED Talk speaker. I really want to focus on more of us having a reflection on where we are in residency and how we can get to our next phase. So here's what we'll do. We'll talk about adding value. Now, adding value, I think, is what our ultimate goal is. I think it's where our field is going. We really want to concentrate on investing ourselves and our study and our work into adding value into the clinical realm. Oh, sorry. So ACGME, like I said, we set out milestones and we set out these things, and if anyone's listening from the ACGME, those are great. This is great. We should definitely do this. But for the rest of us, we should really think about that wasn't ever our goal when we set out for training. We really want to be the best we can be, and how do we get there? What I think about with milestones and competencies is kind of a bare minimum. I know there's a recent trend of bare minimum Mondays, and that's really not how we approach our careers, and it's also not how we want to move forward during residency. So if you've ever interviewed medical students, I've interviewed hundreds of medical students and had a lot of discussions about this, and I asked them, what do you think will make you successful as a resident? And here are some direct quotes for you. I'm going to learn everything possible. I'm just going to learn it all. And I think that's great. It's great to have that kind of goal. I'm not sure how realistic that is. I'm not sure that you can be successful. If that's your bar for being successful as a resident, I'm not sure you're ever going to meet it. I have not yet met it. I don't know that any of us really have. The next is I'm going to be in charge. I'm finally going to stop being a medical student and I'm going to be in charge of something. Probably you'll have a lot more responsibility as a resident than you did before, but it's very rare that you come out of early training and you're really in charge of anything. And I don't think we would put that as an expectation to be successful as a resident. And finally, I often hear, I'm going to make a plan. I'm going to make a study plan and I'm going to follow through with that plan. I think that's great. The first thing I put on my to-do list is to make a to-do list, and I think that that's a great approach to this. But very often they get very nervous, medical students, and they ask me what I think will make them successful as a radiology resident. What is my criteria? And there's something really profound there, because they already know that the truth is in the eye of the beholder, that I decide who's great as a resident, as their faculty or as their program director, or the clinicians will decide who's a great radiologist and who is not. You don't really get to decide for yourself on ideas of success. Now let's switch gears and ask faculty. Let's ask the faculty what they think will make a great resident. This is what I heard 1,000 times. Read about every case that you see. Yes, you have to do that. I am not sure that's going to get you past the core. I'm not 100% sure. There are some rare diagnoses out there that we have to know about. I'm not sure you're going to see them in your day-to-day work. So that's a problem. Learn your search patterns. For sure, we need to learn search patterns. We need to be good radiologists. We have to do what I call the TSA component of radiology. We have to see all the things on the image. So we definitely need search patterns that also make you very efficient. Finally, I heard this a lot. Study for 2 hours a day. Yes, we're going to study for every hour that I'm awake. I'm going to study. That's right. And these are, I think, from a faculty perspective, how to help you to become knowledgeable and to get all the things that you need to practice radiology. But really, this is what they're thinking. Have you finished those protocols? Or do you hear that phone ringing? It's for you, right? The faculty are very busy. They don't have a whole lot of time to think about your success as a resident. They're really thinking about these other things. So what I'd like us to do now, if you would participate with me, is to really think in your mind. Let's ask this question in a different way. Not so much what makes a successful resident and what makes a successful radiologist, but I want you to hold in your mind who you see as a great resident. Every faculty has their list of, their favorite residents, or the residents who just were incredible across the board. Everyone agreed, great resident. Think about those. What does she do in the reading room? What does she bring to the work environment that makes her great? Think about a whole group of them. And then I really want to ask you, if you could go to this poll on any device that you have open. I know many of you have devices open. Open your device to this browser web. You don't have to log in. There's no login required. There's nothing of that sort. And I want you to list for me a quality that you think is true among those great residents. You've already decided they're great, but what makes them great? What are their qualities? Let's see if I can get any of you to respond. Oh, I put a mole in. That's me. I said hardworking. Anyone else? What do you think? So JLRAD, so pollev.com/JLRAD. Curious. Oh, I like that one. Anyone else? Knows. Yeah, working hard. That's true. Asking questions. I really like that. Curious. I think that's a great one. To really be curious, but in a controlled way, to be curious about the topic, to be curious about how you're coming to your diagnosis, that's really good. Team player. Yeah, I think that's true. Oh man, we could spend all day. I want to ask you specifically what you mean by each of these. But you can see we have kind of variable ideas, and I like this one that's centering on being a team player. I don't think anyone has ever answered that question for me. What will make you successful as a resident? No one says, I'm going to be a team player. They all say, I'm going to study hard, I'm going to work hard, I'm going to do those things. But I like that team player is in there. All right, I'm going to go on before anyone puts anything inappropriate in here. You guys did great. Oh, a trusted space. I like this. All right, so let's ask the boss. What do program directors think? So we talked about medical students. We've talked about your faculty. We've asked you what you think. But let's ask the boss. Let's ask the program directors. What do they think? Among my friends who are program directors, they would say professionalism has to be first. I really can't call you great. I won't see you as great if I have to deal with you showing up late to service, or if I have to deal with other professionalism issues. So being a professional in the workspace is not easy. It's not inherent. And really, we only know when things get difficult. So I just want us to think about that for a moment. When we're under stress, how do we behave? And that really is the underpinning of professionalism. It's easy to be professional like this. It's a nice Sunday day, and I'm here with you, but it's very difficult in trauma situations or in other situations. I would say that program directors would correlate great residents with reading a lot of cases. I don't know of many residents who are perceived as great who are on the lower end of overall volume. They would say mostly that those great residents had enough fund of knowledge that they were able to get through cases efficiently. I think that's true. But if you just looked at the numbers, I bet program directors would point in this direction, and they have pointed in this direction. You know, among the great residents, they see a lot of cases. And the last is real ownership of the service. And we've all talked about that being hardworking. Even our medical students wanted to take charge. I think that's true. But really taking ownership of the service, really not letting calls go unanswered, not letting cases go unread, really getting in there and trying to take ownership, practicing in the way that you're going to perform. So this is a video of me trying to actually short circuit this lecture. I didn't want to give this lecture. I thought, let me ask a chatbot what makes a great resident. So the first thing they did was a disclaimer, which is what I did when I started. I said, I'm not a professional counselor. I'm not a philosopher. Chat now does that. It says, this is just some algorithm. But look at this. All of you are having the same moment that I had. First, you're, oh my gosh, that's amazing. Then you're kind of furious. Like, why did I spend all this time preparing for this lecture? Here it is. And then you come to a kind of depressed moment where you're thinking, could they do that with a CT? I don't know. But then the last is an idea and is a thought about this concept. This is the list that this chatbot came out with for what makes a great radiology resident. You can't argue with any of these things. However, none of them are specific to you. None of them know where you come from. None of them know what skills got you to where you are now. It's really just a generic, you could insert plumber into each of these ideas, and many of them would be true, having nothing to do with who we are as radiologists. I would say I got a little insulted when we're talking about empathy. The chat bot is telling me to be empathetic. That really hurts my feelings. So I want to focus on you specifically as radiology residents, how you got here. You were really unprecedented as a group of medical students achieving during medical school, your scores on exams, and then graduating and all your certificates that you gathered as you went. I think, if I can be so bold, 20 or 30 years ago, radiology as a whole was not as competitive as it is now. So now we have, among this amazing group of residents, some of the top medical students in the country. I'll tell you a secret, that wasn't always true of our specialty. No offense to anyone. It's just not true. And now we have amazing, very capable students who come through into residency. But here's the problem, that you can't get to the next phase based on your success in the past. In medical school, what really makes things different from residency? We have a whole different level of responsibility. I think the second one is true, and I heard that from a medical student, that there are fewer external motivators when you move on to residency. Medical school, you get grades, you get Gold Humanism Award, you get AOA, all these accolades, great job, great job. Residency is less like that. Faculty radiology is not like that. Usually not like that. You don't get a lot of external motivators. So you have to find some internal drive and some direction during residency when previously maybe it was just jumping through hoops. Here you are in the middle, surrounded by many demands, many conflicting demands. Go home and study. No, wait. Go read more cases. No, wait. You got to do your training and you got to get your license. There's just a lot of demands that haven't been presented to you before as a medical student, where there's conflicting demands and many bosses. Your faculty, the senior resident, the fellow, the clinician, the chairman, a lot of bosses in this realm. So what has the literature really explored? I want to get through the literature. The first thing we tried to do was predict, coming into residency, what will make you strong resident? What will lead to your success? And these are the things that we started to account for early in residency to try to predict greatness. I will say in a minute that most of those things fell down. Then we went to more descriptive qualities about cognitive abilities and non-cognitive skills. We broke these down and we tried to take out the numerics and move it to more of qualities and inherent to you. The first thing we discovered in this search is that there really are no predictors. The things that we use to select you into residency do not predict your ultimate success as a resident. So we can't look to those, and you probably shouldn't rest on those, that your incredible abilities to this point will get you to the next level. We did, at a point, decide that USMLE Step 1 scores were predictive of ultimate success. However, those scores are going away, and I think a lot of people would argue about that, would argue that your great residents in your programs, we actually never know what her scores were. We never really know. The last thing, and I think this is universally true, is that we really do not predict by these objective measures your ultimate success. So let's again divide them into cognitive and non-cognitive skills. And again, I would summarize this by saying that the broad range of behaviors beyond just basic knowledge really don't predict ability. If you ask 30 different faculty sites what they thought were going to predict your ultimate success, these are the answers they come up with, and the ones that are most universal across programs are actually these. So this is in the literature, looking at faculty, thinking about great residents, exactly the topic here, and it's not knowledge base. It's conscientiousness and interpersonal skills. So we don't think that any one of those is more important than the others, just based on the literature. These are my last 3 points. Communication is key. Here are the literature descriptors. These words show up in the literature as relating to communication. And I would say to us that communication is most important at the resident level and throughout your career with reporting uncertainty. When to say yes, when to say no, and when to say I don't know, and how to say those things. That is probably the key for communication that will make you successful. Systems knowledge, particularly as a resident, but I've seen it in many active duty radiologists who will show up to a duty station and maybe have no idea where anything is or who anyone is, and it gets a little difficult. So the first thing, and a fundamental thing I think for greatness, is really knowing where you are and what system you're working in. The next thing is self-awareness, and this is really knowing yourself, knowing your limitations and the difficulty you may have with professionalism or you may have with work ethic and showing up on time. Those things, knowing yourself, and how does that really apply? How do we correlate that to your practice? The first thing I would say is really knowing the difference between self-confidence and safety. When you don't know, you have to be able to ask that question. And then part of your self-awareness is knowing where you are in the hierarchy as a resident and where do you go for help. The last thing is really showing interest. And this is, I think, the most important part for what we can do to demonstrate greatness is to follow up on cases, really try to get into patient follow-up and understand how what you say impacts patients and really going the extra mile. So my take-home points for you, I'm very sorry, are to reflect, to really take a minute, as we did today. We thought about what does greatness really mean? Who do I see as great, and how do I get there? The next thing is to continue to adapt. What got you into residency will not make you successful as a resident. And what makes you successful as a resident might not even make you great as faculty, but to continue to adapt to our next phases. Remembering the evidence that we talked about today, and finally focusing on the process. I am not great, but I do strive to be great, and I think that's what we can all do, is to continue this process of moving forward and being better. So thank you so much for your time and attention.